We've all been there, right? You're standing in the pharmacy aisle feeling just awful, staring at the shelves and wondering, acetaminophen or ibuprofen? Today, we're going to break down the science so you can make the best choice for yourself and your family.
So picture this. It's the middle of the night. Maybe your head is absolutely pounding, or your child wakes up with a raging fever. You open the medicine cabinet, and there they are, 2 bottles. Which one do you reach for? They seem like they do the same thing, but as we're about to see, their strengths and weaknesses are really, really different depending on the situation.
So let's get to know our 2 main players here. First up, we've got acetaminophen, which, of course, you know is Tylenol. And in the other corner, we have ibuprofen, famous under brand names like Motrin and Advil. They're both absolute giants in the over-the-counter world, but here's the kicker. They work in completely different ways inside your body. Okay, let's dive into a situation that causes a ton of stress for any parent or caregiver, dealing with a kid's fever. Honestly, this is probably the #1 time people really stop and wonder, wait, is there actually a difference between these two? But here's something that might surprise you about how doctors think about fever these days. The goal has totally shifted. It's not about frantically trying to get that thermometer back down to some perfect number. Not at all. It's all about one thing: comfort. Making sure your child can rest, drink, and just plain feel better. And hey, this isn't just some new idea. This is the official word from the American Academy of Pediatrics. A fever is actually your body's natural weapon, its way of fighting off whatever's making you sick. So we're not trying to stop the fight, we're just trying to manage the side effects. You know, the achiness, the crankiness, all of that. So what's the bottom line for parents? It's actually pretty simple. If your child is over 6 months old, both of these medicines are considered perfectly safe and effective for making them more comfortable. You really can't go wrong starting with either one, as long as you follow the dosing instructions to the letter. Okay, so what about that thing you hear about alternating? You know, giving one, then the other a few hours later? And yeah, it's true that can bring a fever down a little bit faster. But, and this is a really big but, it makes it so much easier to mess up the dose, to give too much or give it too soon. That's why the experts say, unless your doctor has given you super clear written instructions, just stick to one medicine. It's just plain safer. All right, let's switch gears from kids to adults. What if you're just taking one of these for a few days? You know, for a headache or you pulled something at the gym. How do they compare head to head? Well, a huge study looked at exactly this, and honestly, the findings were not what you'd expect. And when I say huge, I mean it. We're talking about a study with over 8,600 people. They directly compared acetaminophen, ibuprofen, and even aspirin for short-term use. With numbers that big, you can be pretty darn confident in what they found about side effects. So here's the first big takeaway. Both ibuprofen and acetaminophen were way easier on the body than aspirin was. Now, if you look closely, ibuprofen had a slight edge, but it was so close that, statistically speaking, they were basically in a dead heat. But wait a second, I know what you're probably thinking. Isn't ibuprofen supposed to be the one that's tough on your stomach? That's what everyone says, right? Well, get ready for this, because for short-term use, this study found the complete opposite. Just look at these numbers. When they zoomed in on just stomach problems, ibuprofen actually came out on top. Only 4% of people using it had issues. Acetaminophen was higher at over 5%. That's a really surprising result and totally goes against what most of us have been led to believe. Okay, so that's the story for a few days. But what happens when a few days turns into weeks or months or even years? For people dealing with chronic conditions like arthritis, this is a whole different ballgame. And this is where the picture changes completely. So here's the 30,000-foot view. When you're talking long-term, the main worry with acetaminophen is your liver, period. With ibuprofen, the big concerns are your stomach and your kidneys. Let's get into why that is. With acetaminophen, the risk is really serious, and it's all about the liver. An overdose is one of the top causes of sudden liver failure in the country. And we're not talking about taking a whole bottle here. Just 1 or 2 extra pills over the daily limit, even just once, can cause devastating damage. It is that sensitive. Now, ibuprofen's long-term risks work differently. It basically blocks certain enzymes in your body. The problem is some of those enzymes create a protective lining in your stomach. So over time, that can wear away and lead to inflammation or even ulcers. It can also mess with blood flow to the kidneys and has even been linked to heart issues with chronic use. And this isn't just theory. Check out this data from one study. For people who used these meds long-term, almost 36% of the acetaminophen users had abnormal liver tests.
That's a huge jump compared to about 21% for ibuprofen users. So yeah, while ibuprofen isn't risk-free, that liver risk for acetaminophen is very, very real for regular users.
Okay, we've gone through a lot of information here. So where does that leave us? How do you actually make the right call for you or your family? Let's boil it all down into a simple, clear action plan.
All right, if there's one thing you take away from all this, let it be this. There is no magic bullet. There's no single winner here. The best choice is all about context. It depends on the person, the reason you're taking it, and for how long. It's a totally different decision for a kid's 3-day fever versus an adult's chronic daily arthritis pain.
So here is your safety checklist. And honestly, the most crucial thing isn't what you pick, but how you use it. Number 1, especially for kids, dose by their current weight, not their age. It's way more accurate. 2, always use the little cup or syringe that comes in the box, not a regular kitchen spoon. And please pay really close attention to those dosing times. And a big one, watch out for those all-in-one cold medicines. They often have acetaminophen hidden inside, and that's how accidental overdoses happen.
So, we've really dug in here, from kids' fevers to some pretty surprising data on adults and the serious risks of long-term use. The goal here is that the next time you open that medicine cabinet, you're not just grabbing a bottle and hoping for the best. You're making a smart, informed choice. So the only question left is, what choice will you make?